Hi, and welcome back to Transvox. And today, a different guest, a new guest. No Jenny today, but instead, resplendent in front of me, Lilly Emma Thynne. And it's great to meet you, Lilly Emma. How are you today?
I'm doing really well. Thank you so much for having me on.
Great. Well, I'm looking forward to all things research because that's what we're talking about today. But not just research, all sorts of different bits and bobs as well. Maybe you start the ball rolling, but no, I'm really curious. Lily Emma, that's re hyphenated first names. I'm assuming now you're sort of some part of the landed gentry, perhaps?
Well, I do have a connection to the Marquis of Bath, but not that much of a direct connection, unfortunately. But Lily Emma, Lily was my great grandma's sister, and Emma was my great granddad's mother. And I was originally named after my great granddad, and so I wanted to keep a connection to that name. And so, yeah, that's kind of where Lily Emma comes from. But it's really important that I keep the Emma in. So when I first transitioned, it was just Lily, but I wanted to keep that connection with my former name. So yeah, hyphenated, double-barreled. It makes things really interesting with trying to get people
Yeah.
to remember my name because some people drop the Emma, but then some people find it easier to remember.
Well, look, before we delve into, to some of the details of what we're going to chat about today, why don't you just tell us a little bit about you and what it is that you do?
So I've been a teacher for 5 years. So in 2019, I trained to be a geography teacher, despite having a degree in politics.
Oh,
And my very first job after training to be a geography teacher was technology teacher. And I was responsible, it was a new school, small school, amazing school. And I was responsible for teaching DT, food tech, computer
mm,
science.
mm,
I'm very proud we got the best results, or my class has got the best results in computer science across the trust of schools that year. And
great.
to say that I came from a geography background, I was very proud of myself.
Yeah.
And then I was also lead for technology and teaching and learning. And so I presented at two national conferences about the future of edtech, so educational technology, which after COVID was a really interesting topic. And then I became a teacher of geography, which is what I was trained to do, and also religious studies. And then I moved schools and became a politics and history teacher, and then deputy
Wow.
safeguarding lead. I've written online in the past about keeping children safe and the implications on trans children, which is particularly relevant in the last 2 years.
Yeah.
And I was responsible for their policies at that school and kind of maintaining and reviewing the policies. And then it was a boarding school. And so I lived on site and I was also working with the boarding kids. So that was 5 years of my life. And there was a big moment. And I had a hospital operation, and I thought I'm going to treat this as a reset because I was working with children
Mm,
and LGBT kids in particular, neurodivergent kids in particular. And I had really good relationships with them. I was having a big impact, but on a small scale. And I wanted to take my work further. I wanted to help a much larger group of people. And I thought the way to do that would be to go into research. And so I began my master's last year at Lancaster University, and that's in clinical research in the School of Medicine. I am looking to go on to do a PhD. I've accepted an offer to start a PhD at Lancaster University School of Medicine in medicine. But my research is very much focused on healthcare inequalities for the trans plus community, which I'm sure we're going to talk about. But more recently, I founded and am a director and kind of oversee the operations and the research at Trans Plus Health Research UK, which is a new not-for-profit delivering research to improve trans healthcare that is trans-led and trans-informed at all stages. Because research, to be impactful, first needs to be community-led, community-driven, and it needs to be an open conversation between the people impacted and the researchers.
interesting. You give me a lot to go at there. So where should we start? So 5 years, you packed a lot into 5 years. That's very impressive. So tell us more about the organization. What was the motivation behind starting that off? Because that's new, isn't it? So it's important that we get the word out there about it.
Yeah, yes.
Why was it set up? Who's it for? Tell us about it.
So it was set up in the last month. So it really is,
Mm.
we're about a month old now, maybe 2 months old. It really is new. We've been going out to Pride events. We've been meeting some people on the ground. We were at Brighton Trans Pride. I spoke on both stages there. We were at Caldicot Pride in Wales, and we're going to Crawley Pride. So we're going out. We're trying to reach people in person at the moment, but we are very much a new organisation. And this came about because I did a study in January to April time, and some of the listeners may have come across this study. It
Mm.
ended up being one of the most representative studies in trans healthcare in England, with over 420, if we're being precise, 422 participants, all who were adults and trans plus. Trans plus, by the way, when I'm using this phrase, I'm including transgender and non-binary people, so trans plus makes it a bit more inclusive. And so, yeah, 422 trans plus adults spent about, on average, 50 minutes on a survey, which was a mixture of open-ended and closed-ended questions. And of those 422 people, 300 people gave me their contact details and said, we want to take part in research. We want to work with you again. And, that was over 75% of the participants saying they want to do this again. They want to be part of research. Not only do they want to be part of it, though, they want to co-create, they want to collaborate, they
Mm.
want to have their voice heard. And so
Mm.
that really inspired a movement because I thought we need to roll with this. We need to formalize this. And so, with the support of an amazing team of directors, which includes people who are clinicians themselves, it includes academics, it includes community researchers, we've come together to formalize ourselves as a community interest company, which is a not-for-profit company,
Mm.
essentially. And we are delivering research projects. So we are currently working on 4 research projects, which I'm sure we'll talk more about later on. But to give a quick overview, one is looking at DIY hormones and the DIY community. So we're talking self-medication here. And one is looking at the experiences of trans plus people who are identify as part of the global majority community, a
Mm.
very under-researched area, particularly in the UK. Um, Another is looking at the existence of a postcode lottery, which builds on the work that I did recently that got over 422 participants. And then we're also looking at mental health and the design of hospitals, mental health hospitals for those trans plus people who are sectioned or voluntarily admitted.
Fascinating. So you've got your fingers in tons of pies, but all health related by the sounds of
It's
things.
all, yeah. So we focus on healthcare research, and then we work with other not-for-profits and other community groups that are all trans-led or, working to empower and
Yeah.
support the trans community to disseminate our findings, to empower trans people, because at the heart of it, this is a really difficult time for the trans community. This is a time where we are losing access to healthcare. We are losing our sense of power and autonomy.
Yeah.
And so, as part of that, we need to reclaim that. And to do that, we need research because the research provides the evidence and helps us make informed decisions
Yeah.
about our healthcare needs.
I'm in the field and I'm constantly bumping into people who are doing research. And I sort of wonder, is this more of the same, or are you trying to pull all of these different strands together? What's your sort of big vision for how research around trans health could work in the UK?
At the moment, trans healthcare research is very much led by students, in that you look at the studies that are constantly coming up, and it's someone doing a master's, it's someone doing a PhD. There are some funded studies that are led by, researchers that have been established within universities. So there are some out there. However, the vast majority are students, and this research is delivered. A great dissertation or a great thesis is written, and then it's just forgotten about because the person has got their degree. And so, what we're doing is we're wanting to deliver community-led, community-informed research for the long term. We want
Mm.
to work with the community to set the research priorities. And then we want to collaborate with those students. We want to collaborate with those established researchers in order to bring people together to make sure that once this research is done, it's not forgotten about, it's not put
Yeah.
back on the shelf somewhere. This is research that is going to have impact. whether it be national impact, informing policymakers, which we definitely hope to do. And in fact, I'm co-leading a national project at the moment that seeks to do just that, to do with research priorities. But we also want to have an impact more locally on the community groups, on the individuals. As I said earlier on, we want to empower trans individuals to make informed decisions about their healthcare needs. And to do that, we will work with other researchers, we will work with the funders to deliver that funding.
Yeah. It's interesting because, and again, I've worked in research myself, but one of the criticisms leveled at the door of research is that there's constant research, there's endless research. Trans people are being asked this broadly. I mean, I've had probably 11 requests for research over the last period of time. I don't know exactly what that period of time is. Having looked into it, pretty well, people are asking the same questions from the same community in the same place. And at the end of it, I get another contact saying, well, I'm doing research project and blah, 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 blah. But nothing seems to change. So is there a criticism of the research network where we should be talking more about evaluation as well as research? Because actually, it would be quite good to be showing benefits and outcomes and such like. So I just wonder what your thoughts are on that.
Completely. When I'm talking about this research being for the long term, we're trying to create a community hub where we can share this research. So we have our website, we are creating an online community where people will be able to join and engage on this online community, not only to feed in their ideas for research. Again, it's community led, it's trans plus led research.
Yeah.
So we want them to feed in, and we're having that from some of the Pride events. People have been giving us their ideas. We're actively exploring those projects. But also, we want to disseminate, we want to share our research through those channels. We want to make sure that this research and these findings are not just going to disappear. As I said earlier, we don't want them just being shelved and forgotten about. And so we will share those on our website. We will go to conferences. We want to organize our own conference, taking
Mhm.
inspiration from some of the events that are going on around the country at the moment in the trans community. And we want to organize online workshops. We want to organize spaces to share this information
Mhm.
with our researchers, with the community. So this is very much about making sure that our research does two things, that the research we deliver can have an impact on a national
Yeah.
scale, can influence policymakers, but, and this is the probably even more important one for a lot of people, we want to make sure our research can inform people's decision making as trans individuals when it comes to their
Yeah.
healthcare needs. And when we talk about the impact and whether research can have impact, and I appreciate this is a very slightly different question, but I think it's in the same vein of what you're asking. When we talk about what impact research can actually have, we only need to look to some of the recent research that's state commissioned. We look at the Cass
Mhm.
Review 2024, we look at the Sullivan Review 2025, the Appleby Review 2024, and we've got pieces of research that were delivered by a research team of cisgender people that explicitly, in some cases like the Cass Review, explicitly excluded people with lived experience, so trans plus people, explicitly
Mhm.
excluded healthcare specialists who work with trans plus people. And that research has had a very real effect. We've seen from the Sullivan Review, trans children and young people have lost the ability to change their NHS number, and discussions are ongoing about adults losing that. We've seen from the Cass Review, trans kids and young people losing access to puberty blockers, and suddenly the legitimization of suggestions that maybe being trans is caused by pornography, which is one of the claims that Cass
Yeah.
makes in her review, and that view being legitimized because it's in an official piece of research. And
Mm.
we want to reclaim that. I've been heavily influenced by someone called Peter Beresford. Peter Beresford does amazing work for the disabled community, is openly a disabled person, talks about his experiences, and has been involved in this scene for a very, very long time. And he talks about emancipatory research. I like to think of it more as transformative research, which takes inspiration from someone called Donna Mertens, who's based in America.
Mm.
But whether you're talking about emancipatory research or transformative research, what you're talking about is research that is designed and research that is delivered and research that is shared with the intention of creating social change, with the
Yeah.
intention of improving the situation for a marginalized group. And so, yeah, we are heavily taking inspiration from both Donna Mertens and Peter Beresford's approach.
I think what you're saying here is really quite powerful because I know when the cast review was going through, my sort of jumping up and down on the side shouting, but where's the rebuttal? Where's the center of trans research excellence that allows us to have legitimacy, but also advocacy? So it's that thing about being connected to the whole trans community, but also connected into the sort of corridors of power. And that's the key thing, isn't it? Because you want people to think in the way that people think of other brand mermaids and Stonewall and blah 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 blah. You want people to think, oh, we need some research done, and people say, well, have you talked to these people? And if they haven't, then that research can't be legitimate. So if that's your aim, I'm all for that because I think that was the big problem with CAS. There was no one else they could talk. It seemed, I mean, I'm sure that's not true, but it seemed if you didn't want to make any effort, it was very easy not to actually notice a lot of people jumping up and down individually saying, we've got lots of research. So a body or an organization, I think, is absolutely key. I don't know if that's your aim, but it certainly
Yeah,
seems
no,
legit.
completely. There's a really good quote that links into what you're saying, which is that health research has traditionally been conducted on trans communities
Yeah,
rather than with or by trans communities. And that was
yeah,
by Veal et al. 2022. Veal is very involved internationally in trans research, does
yeah,
has done some amazing work. But I love that quote, that idea
true.
that research is normally done on rather than with. And,
Yeah,
and there is that sense of we need to change that, because
yeah,
how they're going to be miscommunicating, they're going to be misrepresenting data, they're going to be miscommunicating data because they don't truly understand it. They haven't experienced it, or
mm,
they've not attempted to understand the experience of people who have gone through that. And so
yeah.
there is something very powerful, there's something very impactful about research that centers around the lived experience of the person experiencing the problem.
And we are seeing this sort of community researcher sort of role, this community researcher methodology springing up as if it's a revolutionary new idea. It's a tricky thing when you're a researcher to be able to research something which you may have an interest in, a passion, but you haven't been part of. Now, it's not to decry that or to diminish that passion or need or desire or motivation, but there is something that's, it's more interesting to have it informed by the community in which you work. Again, it's the sort of people with learning disabilities, physical disabilities, they often have it was the classic thing about accommodations being made in buildings to support physically disabled people, and they never actually asked physically disabled people what would be useful. So I see the point. Um, I wonder whether the future of research is going to support what you're doing or get in the way of that. Because actually the sort of the funding, the money that's invested on the other side of the political divide, which is sort of broadly anti-trans ideology. How do we fight that weight of research coming from another place?
It is really scary being someone getting into research where there is so much weight behind the idea that either we shouldn't exist or being trans should go back to being a mental health condition, or
Mm,
essentially it's trying to take us back in time. And there is a lot of weight, and as you said, a lot of funding behind those aims, certainly in academia. Speaking again, just putting my pure academic hat on from within a university, it's very difficult to get funding from academic funders to do with anything to do with the trans plus community, whether it be archaeology or healthcare. As soon as you mention trans plus people, it suddenly becomes quite difficult to get funding. So it is a really scary time to be saying, oh, I'm setting up and leading this organization, co-leading a national project, knowing that there is going to be pushback because it's seen as potentially being biased. And it's like that's not what our researchers, we
mm,
don't believe in it being biased. We believe in it being community informed and lived experience informed. And we believe there's a real power and a real impact behind that. It's going to be difficult. I think though that if we look to the experiences that Peter Beresford had when he was beginning to explore his idea of emancipatory research, it was a while ago when he started to
mm,
explore this. And he tells a fantastic story in a lot of his papers. The most recent was in 2023. So you can look up Beresford 2023 and read his report. But he consistently tells this story of um, people with mental health challenges or who are being told that, if they've been sectioned or if they're in a mental health hospital, then they are not going to be able to ever live an ordinary life. And bear in mind, this was a while ago when they were told
Mm,
this. And so a piece of research was commissioned to prove against that, and this was led very much by the community.
mm,
But they brought in people who didn't have lived experience, and those
mm,
people without the lived experience concluded, no, there's no way they're ever going to be able to rejoin society. But look at us now. We have moved
mm,
past, to a large extent anyway, we have moved past that stigma, and we've proved that people with mental health conditions and people experiencing mental health challenges, are able to be part of society. We've proven
mm,
that research wrong. And since then, we've delivered our own research that has shown, and particularly Peter Beresford has delivered research that has shown that people with mental health conditions and challenges are not only able to be part of society, but thrive in society. And while there is still
mm.
discrimination and prejudice, particularly in mental health hospitals and mental health contexts, there is still that around. Things have improved. And so I like to believe that we're on a similar path and that
Yeah.
we are currently under a time where the funding and this idea of not including people with lived experience in research teams is against us. We're currently in that time. But if we look in the next 10, 20 years, particularly if this movement of community-led research is able to build, and if we are able to demonstrate that we can have
Mm.
impactful research that has meaningful research, then that's definitely going to help our cause.
Yes, fascinating. And I guess you're going to suffer that problem that often minority research communities face, which is you're going to be held unfairly to a higher standard of proof as well. And that's a challenge. And that sometimes knocks out the innovation you need to have to
Mm.
actually find the results you need to find. With you with that. Oh, interesting. So you outlined four projects earlier. I mean, they all sound absolutely fascinating, and you're busy. And I'm looking at them thinking, how on earth are you finding the DIY community? Because actually, I work with a charity as well, and people are very shy when they say, "Oh, can
Mm.
I tell you that I'm,
Yeah,
DIYing my own sort
yeah.
of, medical thing?" And it's really important to talk openly about this. Otherwise, we don't want to create a schism in our community about the people who are faced to DIY, because actually, many people are, and they need something that helps them navigate that pathway in a sense, don't they?
Yeah, and I think it's important to also add that some people need to access DIY, some people want to access
Yeah.
DIY. So there is both sides to that. I'm currently co-writing a paper with Dr. Bridget McQuaid on the experiences of the DIY community and why people have chosen to self-medicate. And it very much is some need to, some have felt forced to and don't necessarily want to, some want to as well. So there are these different branches, but at the heart of it, as you said, is the need to make sure that they feel informed about
Yeah.
what the medication is that they're taking, and they need to feel supported by the appropriate organizations and the appropriate support groups. And so that's really important. There is this phrase thrown around often of harm reduction, and through the study we're going to do, we're going to explore more how the trans community feels about that phrase. So I don't want to necessarily own it at this point. However, I do want to say that should there be risks associated with self-medicating, which at this stage we haven't started the study yet, so I can't
Yeah.
confirm nor deny whether there are risks, but let's assume there are some risks with that. If there are risks associated, it is important that there is research that outlines those possible risks and outlines the recommended steps that organizations and individuals can take to keep themselves safer and to access support throughout that time. So yeah, it is very much that's what we're aiming to do with that study. That study is going to be both qualitative and quantitative. So when I'm referring to qualitative, I'm talking more about people's subjective experiences, their lived experience. We've got open-ended questions for the qualitative side. And when I'm talking about quantitative, I'm talking about raw data, numbers, clinical trials, that sort of thing. So with the qualitative, we're looking to do a large-scale survey to better understand the experiences of trans plus people who are self-medicating, which will build on some of the reasons that I've already explored about why they're doing it. But more importantly, it will also look at, okay, what's their confidence like? Do they know what's in this medication? Do they feel confident medicating themselves? What support can they access? That sort of thing. So that'll be half of the project. The other half of the project is looking at what's in this medication that they're taking from a sample, and also what effect is that having on their bloods. So it's a two-pronged approach, and at the end of it, it all comes back to a steering group of people with lived experience in this area, and clinicians, in order to work together as a steering group to then identify recommendations to support the community going forwards. And I'm
Yeah.
sure that at the heart of those recommendations, again, I don't want to predict the outcome here, but based on my findings already from the
Mm.
study I've already done, I would imagine that what will be very clear is the government, the NHS banning and outright not supporting anyone who self-medicates will
Yeah.
cause more harm. So, at
Yeah.
the heart of these findings, I'm sure this will come across, and we will make sure that whatever our findings are, cannot be used to argue for banning self-medication
Yes.
and DIYing. Will be very clear,
Yes.
based on the data that we have, and I'm sure the data will show, based on the study I've already done, I'm sure the data will show that it would cause more
Mm.
harm if they were stopped.
And that's really important, isn't it? Because medical institutions are often highly evidence-led, data-led, and actually they don't have so much of a political aspect. I mean, the management and bureaucracy and such like does, but often you'll find clinicians who are
Mm.
literally clinical scientists are more persuaded by evidence and such like. So tease me now, tease me, Lily Emma. What are the sort of projects might you have coming down the stocks that we might be interested in, without obviously giving away any confidences? Where's the scope of work going? Where's the
Yeah,
ambition going in terms of actual things?
yeah. So we have the four projects that I've already talked about, and they are in the process of being set up. We have researchers assigned to them because my role is very much kind of overseeing those studies, and I'm involved in supporting them. But there are research leads because I do not have time to be leading all of these studies.
Yeah.
So we're in the process of setting these four studies up, and working with the relevant researchers. I've already mentioned I'm also co-leading a national study, which, while I can't talk too much about, it is an incredibly exciting study. It will be a large-scale study, so it's across the whole of the UK. And I would just say make sure that you're following Trans Health Research UK on Instagram, or you're signed up to our newsletter, because in the next few months we will be giving information on how we want to hear from Trans Plus community and kind of the ways that
Mm.
they can get involved. Because for that project, we need as many Trans Plus people as possible to get involved. It really is power in numbers,
Yeah.
even if it's qualitative data that we're looking to collect, there's power in numbers. Very much looking to get as many people involved in that study as possible. So just make sure that you're subscribed to the newsletter or following us on social media. And then we're also looking, we're looking to build this community. So we're looking to build what you could call an innovation network, because at the heart of what we're seeking to do is to
Mm.
innovate. You used this phrase
Mm.
earlier yourself. We don't only want to deliver research that's peer reviewed. That's a really important part of what we do,
Mm.
definitely. But we want to deliver research that can lead to change. And to lead to change, this research needs to have impact. And so we want it to also lead to possible new projects. And so
Yeah.
we're looking to do outreach. So we're currently working on this on a proposal to be that will allow us to do outreach to local groups all across the UK. So we want to go and visit local trans groups. We want to chat to them for a few hours. We want to hear their experiences of healthcare, their ideas. And so if anyone wants to support that or wants to reach out, then please do go to transhealthresearch.org.uk, reach out via email, let us know, and we will add you to this list and make sure that we get out and meet you. And also, alongside that, we're building this online community. And while it's not launched just yet, again, make sure you're subscribed to the newsletter, because as part of this online community, we want there to be a safe space for people with lived experience, for trans plus people, to be sharing their ideas. When I went to Caldecott Pride, we met someone who had this idea for a study to do with testosterone, and it was a fantastic idea, and it was an idea that neither myself nor anyone on the director's team would have thought of. It needed
Mm,
someone who's experienced
yeah,
this issue to come forwards, and so we want that as well. So, like that person, reach out, let us know your ideas, and we will aim to include that in any of our studies or look to submit new funding applications. Or if you're a researcher, reach out. We are looking to create this community of trans plus people, clinicians and healthcare specialists, and local organizations, so
mm,
that we can deliver research that's impactful, peer reviewed, but also innovative and leads to actual change, like
yeah.
project ideas.
And I'm guessing some sources of funding wouldn't harm either. But I mean, your ethical fundraising policy must have all sorts of exciting caveats within it.
We are very much looking to fund future research.
Yeah,
We are in the process of, sorting the funding for these four projects. However, future research, there will be a need for it to be community funded. And so, yeah, we have a fundraising page. We are actively accepting donations to help us fund this research. But as we are early in our life, we as an organization, we are still establishing ourselves first. And but
yeah.
yeah, certainly any help with fundraising is really important.
Very good. Okay, so just run us through those links again. You're on LinkedIn as an individual. And just remind us of the name of the organization again, because you've only said it 43
So,
times and I've already forgotten it. So you've got to say it one more time.
so on LinkedIn, it's Lilly Emma Thynne as an individual. On Instagram, it's at Trans Health Research UK. You can go to our website, www.transhealthresearch.org.uk. The organisation is called Trans Plus Health Research UK, and we cover the whole of the UK.
There you go. Excellent. Very good indeed. And I mean, anything we can do to help, that's great. If you ever, and if anybody wants to reach out through us because you can't remember the names or anything, we'll obviously pass people on. So, Lillian, it's been brilliant to chat to you today. Thank you so much for joining us. Any last thoughts, or are you funky?
I am looking forward to working together, both us, but also I'm looking forward to working with trans people across the country to deliver change. This is our time, this is our moment, and we've got to embrace it.
Thank you so much for spending time with us today. I really, really, really appreciate it. So, you take care.